Good morning and afternoon, everyone. Welcome to our panel, Digital Inclusion, Meet Energy Access, Integrated Partnerships for Healthier People and a Healthier Climate. My name is Leland Smith. I'm a digital strategist and advisor with Apt Associates on our data and digital services team. This year, I've had the great fortune to be supporting one of USAID's programs, the Health Electrification and Telecommunications Alliance, under the Power Africa umbrella. And we are going to talk with you a little bit about that program, some of the partnerships that we've developed, and how we are solving some really concrete problems in inclusion and access to things like energy and telecommunications in the health industry. HETA is a USAID Global Development Alliance under the Power Africa program. So it's a partnership bringing together public and private sectors and donors to solve a specific development challenge. And in this case, it's to electrify 10,000 rural health facilities over the life of the program. In this panel, we're going to dive deep into HETA and our partnerships models for clean energy for health facilities. We're really working at sort of the nexus of clean energy. And so, of course, climate change mitigation with healthcare and with connectivity and inclusivity. We're providing, both energy options, access to some infrastructure, as well as providing some of those sort of use cases that sort of anchor productive use of energy and connectivity, coming at this problem from sort of both a supply and demand side simultaneously. We're going to be speaking with several key members of this alliance, covering both the public and private side. We're going to dig into how HETA operates, what our secret sauce is, and how we see ourselves solving some of these challenges. And I'd like to kick it off by allowing each panelist to introduce themselves and take just 1 or 2 minutes to talk a bit about their role, what inspired them to work on this program to tackle issues in health electrification and digital health. So I'd like to start out with Gina, please.
Yeah, thanks, Leland, and good morning, good afternoon to everyone. My name is Gina Katie. I work for USAID and currently sit as a member of the Power Africa Coordinator's Office. Power Africa launched this program due to the COVID-19 pandemic and the agency's request for all of our investments to have some effort in COVID response. And I was the lucky member to take this on. And as I did more investigation and discussions with our global health colleagues at USAID, realizing that their interest in electrification actually doesn't lie in electrification at all. It lies in having that strong digital connection for the data-driven approach that global health and other health programming across the development space really takes. And so that is why this is not just a health electrification alliance, but this is a health electrification and telecommunications alliance. We really see there's a value to working with our telco partners in expanding data availability and connection across the not just health facility landscape, but usually those are the anchor facilities in many communities in which we can then grow other productive uses and economic growth and expand digital connection for the health space. So I lead the HETA public-private partnership from the USAID side, and we're in the first year of implementation, and we are really excited to dive in to our successes in today's panel. Thank you so much.
Thank you, Gina. Let's move to Joanne, please.
Good morning, good afternoon, everyone. My name is Joanne Chahenza, the project director on HETA, working with Apt Associates, the lead integrator on the program. As Gina has mentioned, HETA is a global development alliance, and we're really driven through public-private partnerships, and we really work in conjunction with the private sector to be able to achieve our objectives. Some of the other alliance members include Resolve, an NGO based in the US, Bechtel.org, the social enterprise of Bechtel. Then we've got Orange, the mobile network operator, also as one of the key core partners within HETA. We utilize our funding as leverage funding to be able to catalyze additional philanthropic, grant capital, and private sector capital. As you know, right now, 1 in every 8 human beings on this globe are actually served by health facilities that, number one, do not have reliable power, or number two, are served by a very weak grid. And we really want to change that narrative, starting with sub-Saharan Africa. So in sub-Saharan Africa, close to 100,000 health facilities do not have power. And as HETA, we are only solving a tenth of that need. And we're really looking forward to, sort of forging the relationships, forging the partnerships to be able to undertake this task. And of course, the benefits of health facility electrification are numerous. We see health workers enjoying longer hours at work. Of course, there's effective record management, as an advantage or as a result of having robust power. The other key things, of course, with digital connectivity being able to be included within, the intervention, then we are able to go one step further and enhance, proper record management keeping, within these health facilities. The other key thing is also telemedicine, right? So being able to embrace such innovations. So far, HETA is operational in 11 countries, and we'll be taking a deep dive on Tanzania and really looking at how we are forging the private sector partnerships and being able to, of course, with the end goal of realizing better health outcomes. Thank you, Leyland.
Thank you so much, Joanne. And then finally, we have Ibrahim. Please go ahead.
Hi, my name is Ibrahim Dathir, a country manager for MaishaMeds in Tanzania. MaishaMeds is a tech startup company that is building software for private pharmacies and clinics in Tanzania, Kenya, Uganda, and Nigeria. This is where millions of people across Africa seek healthcare. Our goal is to help digitize these small businesses to improve quality and affordability of their services. In my role as a country manager, I have been working with HETA to bring electricity and connectivity to some of the pharmacies and drug shops in our network. About 2/3 of these facilities in Tanzania are called ADOs, or accredited drug dispensing outlets. These tend to be located in peripheral areas where electricity is a major challenge, but also these are small businesses with limited working capital that can benefit a lot from digital tools that help them to make sales and manage their stock. Getting electricity is not just about implementing our measurement software for their businesses. It means they have enough lighting to stay open later and serve communities. The solar panels we are installing with HETA reduces their operating costs, and in many cases, it creates businesses because customers can charge their phones at these locations as well. We currently have 700 locations in Tanzania using our software, and nearly 3,000 total across all the countries that we work in. Thank you.
Thank you so much, Ibrahim, and all of you for some of that background. We're now going to have each of our panelists talk in a bit more detail about HETA and their role and their organization's role. And so we've sort of organized it. We're going to kind of start at the top level and move down into some more very country specific implementation stories and successes, and get a little bit more out of that context, how we're approaching it, how it looks on the ground. So we'll start with Gina, who's going to give us a bit more of the background on HETA, the links with energy access, digital inclusion, and climate. You gave us a bit of this background already, but for those of us who are maybe a bit less familiar, it might help to hear more about the HETA concept, how it originated, why the decision was made to emphasize public-private partnerships as sort of that essential mechanism for progress.
Yeah, thanks, Leyland. So Power Africa, I'll start from very top. Power Africa is a presidential initiative that started in 2018 with 30,000 new megawatts and 60 million new connections. We're about halfway there in our goal for that overall approach. And HETA is basically one of our new productive uses in which we're looking for not just what that connection will do, or what that connection is, but what will that connection do for a community? And so, as I had mentioned in my intro, HETA began during the COVID-19 USAID response, in which all offices were asked to provide some response during COVID-19. And we really sat at Power Africa saying, what can we do? We support utilities across sub-Saharan Africa. And so I went back to global health colleagues and asked them to understand what were the real electrification challenges that they were seeing in delivering their development objectives and services. And what we found was that a lot of the global health sector's work is not just, it is all about saving lives, but to do that, data is very important in order to make decisions on where investments will be made and how healthcare is going to be delivered. And so what I realized is that that reliable connection is really more important for the telecoms industry, more so than necessarily the energy industry where Power Africa came from. However, Power Africa has a strong network of private sector partners. We have about 182 private sector partners right now. And so we know at Power Africa how to build strong partnerships. And because of this digital connection, it just made sense to me that we reach out to that telco and mobile network operator space to understand where they can make a play into this alongside of us. And as we began to scratch that surface and have these conversations with Orange, with Vodacom, with GSMA, Africell, and others, we realized that there's not only a development objective here, but there's also a business and market-driven approach in which they can increase their business development opportunities. And so because of that, it just made the most sense to develop a public-private partnership in which we're investing in some of the, to help mitigate some of the risk in developing these new market-driven approaches. And so with that, we're seeing a lot of success in expanding not just electrification at facilities, but seeing the network coverage expand. And then with that, we're seeing productive uses such as kiosks to top off cell phone coverage, to charge phones, as Ibrahim was mentioning, at the ADOs, and other ways to have revenue generation that increases economic growth and really creates this community development hubs, with the health facility being an anchor of that development hub.
Thank you so much, Gina, for all that additional background, particularly on the Power Africa side of things. Can we maybe take a quick look at some of the poll results that have been coming in? For those of you who haven't seen it on the main virtual page there, we are looking at, we have a couple of poll questions. And one of the first ones that we asked is, what are your main challenges in designing and implementing digital health solutions? And the two top ones that we see should be maybe a little bit unsurprising, and I think mirrors quite a bit what Gina had just said. access to that reliable real-time data for decision making is one of the things that, of course, we hear about all the time in the digital health sector. And then, of course, anybody who's been working in development, particularly on the digital side, knows how much mobile and internet connectivity impacts the ability for us to do our job and have impact. So I guess in some ways I'm perhaps not a bit surprised to see those particular answers show it on the top, but if you have not yet answered those polls, you can find those at the bottom of the watch page, and please do provide some additional feedback there. And then on the second one, we have what are the challenges for global health? Oh, I think we can, yeah, there we go. What are some of the challenges for global health programs? And the one that we've seen come out on the top is challenges in sort of finding that common language and shared objectives with sort of the digital folks and the health folks. And I know that between Joanne and Ibrahim, they're going to have quite a few insights on how we've been able to sort of bridge that gap and find some of that that common ground there. On that note, I'm going to throw this over to Joanne to zoom in a little bit into one of our programs. So HETA is working in several different countries, and Joanne, you can probably give an accurate and up-to-date count on that. But in this case, we're going to focus on Tanzania. So Jen, maybe you can talk a little bit about how these partnerships are coming together and taking place. What are the partnerships we've developed, who are the players, and how we're looking at keeping them viable, keeping the private sector engaged and happy in sort of electrification and connectivity for health.
Absolutely. So let me take a step back and say that HETA is currently in 11 countries. As I've mentioned, Tanzania is one of the countries that we are focusing in. And so far, we have had 300 facilities electrified, and we are moving towards sort of closing that mark with close to 190 electrified under the partnership with Maisha Med and Zola, an energy service company based in Tanzania. And for HETA, we really look at the entire spectrum. So we're able to support dispensaries, larger health facilities, cold chain facilities, and we are a little bit agnostic on the type of health facility that we offer support to. The other key thing that we include in our business plan and business models is really sustainability. We want to be sure that we design longevity in the systems that we deploy to make sure that operations and maintenance is ideally ingrained in what we do. I know some of the business models that Gina had talked about are really key in the design of our programs. So both the making sure that we're working with telcos and mobile network operators to be able to look at leveraging the tower infrastructure. And in most countries, you find towers are located within health facilities. And, tower companies on one hand really have net zero goals for displacing diesel. Health facilities, on the other hand, have got this enormous need to be able to have reliable power. So we're trying to thread that needle and bring, those two sectors together for them to have a conversation and for us to co-create different business models. So having said that, I will take a little bit of a deep dive on Tanzania. As you know, access to reliable energy and digital connectivity still remains a primary challenge for most countries within sub-Saharan Africa. And in 2019, only 40% of Tanzanians had access to electricity. And of course, this is actually very different in the different regions. Of course, with the urban dwellers having a higher percentage and the rural, areas, the percentage is much less. In most cases where there's no power, of course, digital connectivity is really non-existent. And, and there's just a real need to be able to ramp up power so that then power is actually an enabler for digital connectivity. So there are several regulatory frameworks in Tanzania that have supported distributed renewable energy solutions. As you know, as HETA, we work within the distributed renewable energy space. And Tanzania is a thriving market for private sector participation. And in this regard, we are working with ADOs. ADOs are the accredited drug dispensing outlets and pharmacies. And we've got more than 18,000 of these within Tanzania. And we are currently in a pilot with Maisha Meds and Zola, where we've provided a subsidy to be able to make the the gadgets that Maisha Meds is selling, the digital connectivity piece, a bit cheaper for the end users. And also with the Zola kit, which is really a solar home system, we've also been able to apply a small subsidy to be able to make that affordable to the end consumers, which in this case are really, women-owned businesses. And we really feel that that is very catalytic, from a gender and social inclusion angle. So energy access is really critical in terms of cold storage. And we find that, by being able to provide, both the digital connectivity and also provide, an avenue for cold storage, then we are enabling the ADOs to be able to stock, medicines that predominantly would not be available if there was no reliable source of power. So we are really excited about the pilot that we've launched, and I'll let Maisha Meds and Ibrahim be able to give us a little bit of the nuances on the exact infrastructure that Maisha Meds is deploying. But what I'd like to say is that, of course, it comes with a basic package, a tablet, a point of sale application, and a bit of training. And that bundled package is actually able to, support these ADOs. And we are prioritizing several regions. For us, the focus regions in Tanzania include Iringa, Katavi, Mbeya, Njombe, Rukwa, are some of the priority regions. And the reason why these are priority regions is because we feel that this is where there's really, a lot of the intervention will really go a long way in being catalytic in this market. So we're really looking forward to taking this intervention and trying to scale it up and open it up to possibly other regions, and also greater collaboration with other, energy service companies and other digital connectivity companies to be able to see, how do we provide this package that's able to unlock, the benefits that are both within the digital connectivity space and the energy space. So I'll leave it there and hand it over back to you, Leland. Happy to take more nuanced questions.
Thank you so much, Joanne. So you gave us a really great view on how we've developed some really specific partnerships. In this case with Maisha Meds and Zola, to cover both sort of the on the one hand the actual energy access through Zola, as well as that productive use. And the training, of course, because one of the key capacities here is not only do they need access to the devices and the connectivity, they need to afford it, and they need to have a reason to use it and be able to invest in it. Be able to continue to invest in that connectivity and use of it. So I'm going to move to Ibrahim now to zoom in yet one more level. Ibrahim is here, of course, to represent Maisha Meds, the partner that Joanne mentioned. And I'm super happy he's here because he can talk a lot about how it's getting operationalized on the ground. As somebody, Ibrahim, who's working every day, to engage private health facilities, to invest in energy and solutions, how do you go about convincing them to come on board? What does it take to convince a facility to, invest their own money to digitize? So maybe you can talk a little bit, about how Maisha Meds works, and how it's been to bridge that divide between, sort of the digital product maker, and that end user in the health world.
Thank you, Leland. Yes, convincing an adult to come on board is a bit challenging because we know these people are used to their old ways of managing their businesses, and also they lack business management training. So convincing the owner will be different from when you meet the dispenser at the facility. So when pitching to the owner, we normally use a technique of asking questions. And as they answer, they see how the system can help them be more profitable in their business. My top 3 questions that I usually ask whenever I'm in the field First, I ask them, how do you manage your facility on a daily basis? So here I am trying to probe and discuss how he keeps track of their expiries, but I also want to see how he ensures that he buys another stock before the current stock runs out to avoid stockouts. And then the second selling question that we ask is if in case you travel or you are at work, how do you keep track of what's happening with your business? So here also we are looking to show them that with our solution, they can track their business remotely without being at the facility. And the last question we ask most is, how do you decide on what to stock more and what to stock less? Also, with the measurement solution, you can see the medications that are selling more and the medications that are selling less, so you can start to prioritize with that information on how to stock. Talking on this, I remember one of the most difficult sales I ever made during this period was to the owner of the chain pharmacies. We call them chain pharmacies if a person owns more than one pharmacy. And this particularly owns almost 13 facilities, a mixture of adults and pharmacies. The first day I went for a pitch, I tried using the 3 questions method. He did not show any interest. I just said thank you. He said thank you, I will call you once I decide. So I knew right there that this guy did not buy my pitch. So I went home disappointed, kind of, but I did not give up. I started doing a small research on him, and it turns out he owns 13 facilities in a different regions. So he already had used a couple of other systems, but all have failed to solve his pain points. So while doing that research, I came across his manager and the IT guy. So I requested a meeting with them. And a good thing, these were my fellow tribesmen, so I used that to my advantage to secure a meeting. Then I probed more on what specific features are they looking for in a system. I realized that we had a feature just for them, but I just forgot about it because not many clients ask about it. This feature provides a dashboard to manage your facilities without needing to log in on each facility separately. Plus, you can even compare these facilities per performance. So I didn't even ask for a second meeting with that owner. I just went ahead and asked the tech team to build me a dashboard for demo. Then I sent him a link with the username to that dashboard. The next day, he reached out asking me, oh, Ibrahim, let's meet and discuss the pricing. You know, I have 13 facilities. I want to onboard them at once. So yeah, pitching to the owner and pitching to the dispenser when you're in the field is different. So when you meet the dispenser at the facility, so now you want to show this dispenser, first to interest this dispenser to cooperate with you by giving the owner's contact, but also by relaying a message to the owner that you were there about the product you are selling. So you want to show the dispenser how the system is going to help them simplify their work, how it's going to reduce the time spent on preparing reports. Most importantly, you show them that the system will increase transparency between them and their employers. But the most selling part with the dispensers is when you show them, but that if the system is used properly, it can be a point of reference to request for a raise with their bosses. So if you show them clearly, they end up cooperating and you end up securing that deal. Now, what happens after I have just onboarded these people? Because, you know, the issue is not just about bringing them on board, but to keep them, to make them want to continue using the system. The one thing that we do to make them see the value of the system is to provide the free stock count for the first 1 to 2 months of onboarding. So before onboarding, we have a Google form to capture certain information, including their estimated monthly sales. Our team will visit the facility, conduct a free stock update by counting what is on the shelves and cross-checking with what is on the system, and then give a report to the owner by showing them their estimated size at the onboarding stage and the actual size after the 1 month of system usage. Most of them do not believe what they see and end up putting more pressure on the dispensers to make sure they dispense everything via the system. But also, if there is any kind of loss, we advise the possible reasons and the possible adjustments to be made to avoid it for the next time. And also, 80% of the ADO owners in Tanzania are female owned. And I think these might be the reasons from the years that I have worked with MaishaMeds. First, most of these women are health practitioners. They are either nurses, midwives, doctors, etc. So they are driven by the sense of wanting to save their community. As they approach their retiring years, they start finding ways to continue serving the community, and starting an ADO or a small clinic seems like a viable option for them. But also, salary alone is never enough. So they are looking to start a side hustle in the market. They know at least they stand a chance. So out of almost 20,000 ADOs that we have in Tanzania, 80% is owned by females, and I think that those are the reasons why. Thank you.
Thank you so much, Ibrahim. And as somebody who's coming, really a lot from sort of the digital side of things, I thought that, your first point with the 3 questions method really stood out to me, particularly when you said, asking people about what kind of features they need. That's a really fantastic example of, bridging that gap between, between the tech people designing products and the users who are using them. And so going in and being able to really understand how somebody is going to use a product and being able to come out and sort of show them, look, what you need most is right here in my hand, and you can have it. I think that's a great example there. I'd like to talk a little bit about some of the sort of the equity aspect of it. I know, Ibrahim, you mentioned that, of course, 80% of ADA owners are women. Sort of a little bit more broadly, what are some of the other ways that we're, the HETA is tackling equity? Maybe examples from other countries, or sort of how that's a bit of a guiding principle across the program. Gina, could you maybe start with a few comments on that?
Yeah, sure. So one of the ways that we're doing energy service providers to be providing that solar or clean technology to the facility, and what we're doing through that support to the energy service providers by providing them attractive lending, finance, or other financial vehicles. We're not doing a full grant, in which what we're trying to do is support their capacity building. And most of those local providers are country-based providers who are then going to be hiring local workers to help operate and maintain those systems for the benefit of the communities. And so we're not asking the local healthcare workers to then also be solar engineers. That is way beyond what they already have a tough enough job already. We're not going to add that on to them. So what we're looking to do is improve the local capacity of the technical part of the energy side. And that really generates new jobs, new opportunities to expand and extend that electrification beyond the health facility, and really integrate some more technical based opportunities within communities that may not have it unless there was energy provided. And then just an emphasis on that, we see time and time again, there are many studies out there that show that energy is maybe one of the only investments in which you get more than a one-to-one return. So the more you invest in energy, and the more the GDP or the more that the communities and people have access to electricity, that GDP growth is exponentially extended, and because of that, there's more public services because the tax base is higher, and then that development of that country grows even more. And so we're trying to do that on a very much a local community to community basis, but really trying to add that across each nation's goals of electrification, digital connection, and that economic growth.
Just to add to what Gina is saying, I mean, as HETA, we work to fill the gaps in energy access. And there's definitely some automatic benefits to women, girls, and historically excluded populations. Needless to say that, of course, having reliable power ensures women can give birth safely at night during emergencies. And, more specifically, when it comes to the program design, we have several goals that are related to gender and social inclusion. We want to make sure that we are ensuring equitable access to improved health services by women, girls, and historically excluded populations, as I've talked about earlier, and also expanding the participation of women, girls, and historically excluded populations, especially in energy and telecommunication sectors, where you find, some of these sectors are predominantly male dominated. We also want to support energy and telecommunication service providers, as Gina has talked about, to be able to adopt policies that promote workforce equity. So in the different countries, we are working with like local institutions that are women-owned within the value chain. And it's really exciting to see women engineers, really happy and ready to do installations, to do troubleshooting, to do, routine operation and maintenance. And we want to transfer this same skill set within the ICT market and really see, pockets of opportunity to be able to work with local women-led and youth institutions. And also for us, the whole aspect of being able to hone skills in conjunction with local training institutions is very important, so that in the event that there's a need to troubleshoot, you're not having to send expertise from far away, that you're actually utilizing the local workforce that is located within these localities.
Great, thank you for that, Joanne. And I'd also like to maybe talk a little bit about some of that data component, which is, as a digital person, is very near and dear to my heart. But it's one of the things that came up in the poll, and I think we've touched on it in a number of ways. Ibrahim, I think you gave a really a clear example of how the data that's being collected, being enabled by this connectivity, is actively helping ADOs make better decisions to sort of manage their business. But it would be great if we could, maybe also get either some examples or how HETA is sort of maybe approaching this in some other countries, in terms of enriching that that health data ecosystem through provision of connectivity, or through partnerships maybe with medical device providers or sort of other service providers. And Joanne, maybe you're nodding your head, so maybe you can start with this one.
Absolutely. So there are many examples to draw from. I think the one that is very relevant to this conversation, now zooming away from the smaller facilities and looking at, larger health facilities, not necessarily, like drug dispensing units. There are two ways of doing it, right? So the first one is being able to work with mobile network operators to provide connectivity at a discounted rate. There are some that have got really, robust CSI initiatives, and they're actually able to electrify health facilities at no cost. Other mobile network operators would like, some form of discounted cost to be able to put these health facilities within their network. The other key thing is being able to provide those digital kiosks where we enable mobile money applications near the health facilities. And I think that is really additional when it comes to sort of the strategy of being able to reach the catchment areas within the health facility. And if there is a clear justification of being able to enhance or boost the equipment near the health facility, then I think, those are conversations that we've been having with mobile network operators to make sure that, that is enhanced so that then, these health facilities are receiving, very robust, internet within the facilities. The other one, as we'd said earlier, of course, is, yes, Gina, I think you have something to add before I go to the next one. Okay, great. So the other thing that I'd like to talk about, of course, is the opportunity. And I seem like I'm repeating this, but I think the opportunity for scaling this model is really enormous. The ability to work with tower companies. I mean, most of these tower companies have got a real need to be able to, displace the diesel with clean technology, and being able to influence the pipeline development of these tower companies, I think, is really something that HETA, we're very focused on, doing it from that perspective. The other key thing is remote monitoring. We want to make sure that each of these facilities has got a platform where we can be able to remotely check whether the facility is up and running, have a dashboard that shows any power outages, any problems with operations and maintenance. And that way we can really keep true to our philosophy that sustainability is the key to HETA's success. And the remote monitoring platform that, of course, has to be digitally connected would really provide us that platform. Thank you, Leland.
Thank you, Joan. Gina, anything to add to that?
Yeah, I would just add there's also some really amazing broad stroke opportunities when we establish this strong digital connection. The towers, cell phone towers, actually bring in a lot of climate information that climate scientists can be using to help measure both weather activity and the changing climate sort of indicators. And along with that comes the health nexus into that. A lot of our malaria office folks are very interested in HETA because the cell phone towers can take in moisture levels. And as the moisture levels go up and the data to malaria cases goes up, we can track where outbreaks are happening and try to contain them into and act on them in a more real-time basis than we can if we don't have that data. So there's the very individual case by case community to community that Joanne and Ibrahim is going into. And then there's some of these broad information that we can make some strong development and policy and investment cases for what we should be doing on a larger scale for global health and climate.
Thank you, Gina, and that's a great link to the climate change aspect, which I'd also love to explore. And it actually reminds me of a case study I read pretty recently in which the GSMA had one of our HETA Alliance partners has been experimenting with how they can use interference between microwave towers to measure precipitation on a hyperlocal basis and in a very accurate way. And I thought it was a great example of how we can be really innovative on how we're collecting more granular climate data. But speaking of climate, yes, please go ahead, John.
Apologies to interrupt.
Oh, sure.
We would really, the angle of climate finance is really fascinating. We are really looking at monetizing the environmental attributes with installation of distributed renewable energy resources. For you to be able to clearly make a strong case for monetizing environmental attributes, you do require connectivity, and remote monitoring would be sort of the basis of that, and a clear and robust way of verifying, the environmental attributes attendant, to a health facility once you electrify using solar. And that is really another angle that we need to sort of outline, that there's this huge market of distributed renewable energy credits that is available for any health facility that is installing solar and displacing diesel generators. So that's another angle that I think is very catalytic and additional to this conversation.
Yeah, thank you, Joanne. That's fantastic, and I'm glad that we're linking this really closely with climate change. And I think obviously sort of on a high level, we're making extensive use of renewable energy products, to mitigate climate change. But Gina, do you have any other sort of broad high level comments about how HETA and I guess Power Africa more broadly sort of fits into USAID's climate change agenda? Obviously, COP is happening right now. Climate change is on our mind every day, but these weeks, it's of course it's number one.
Yeah, no, thank you so much for bringing in the climate angle. I actually am a climate officer at USAID and have worked on many climate programs across our global landscape. So we really see this as there's a couple layers to the climate agenda for HETA. One is the obvious displacing of diesel and emissions reduction. However, if you really take it on a case by case, the megawatts is kind of low. And so it's not going to be a large displacement. However, if you look at it as business as usual trajectory, in which if all of those 100,000 facilities were connected to either a coal-fired power plant or diesel, then you would be able to make the case that we are displacing future emissions. The more impactful climate discussion that we're having within USAID climate space, and that links into the strategy that was just put out in May, I think, is the resiliency piece. Climate adaptation is a very important piece to the entire climate change agenda. We often talk about clean energy and sustainable landscapes, but adaptation is really what's going to help us, human race, adapt to the changing climate that we cannot necessarily stop. And so what HETA is doing is creating that resiliency and independence of these health facilities and the surrounding communities. So if there is a shortage of gas, if there is a load shedding or some sort of disruption in the grid services, these health facilities that are connected through battery plus solar are not very much affected. And so services can still be rendered, and life with the productive uses as well can still be going on. And so that really creates a very resilient community that doesn't necessarily have that dependency on a more traditional energy system. The other thing that we're seeing is this climate health nexus of what I was mentioning in terms of being able to be very responsive on like infectious diseases and other things that are being impacted and more exacerbated because of the changing climate and across the landscapes, global landscapes. And so we are able, so if precipitation levels are very high and we're starting to see malaria outbreak, we can go and respond immediately. If we're seeing drought cases, because that is being reported through the digital systems, and some other health response to that, we're able to respond in a more effective way. And then also our health teams are ready to respond to climate changes. They know when the heavier months, rain months, are happening in countries, and so they procure their commodities to respond to that. If we can create more resilience in which the heavy rains or the droughts aren't impacting how their machinery and other devices are working because electricity is off grid and less independent or less dependent on that power, we can create more or less waste in that commodities procurement system of the global health sector.
Great. Thank you so much.
Can I add something?
Please do. Please do.
And in terms of just the numbers, we only need 5 billion to be able to close the energy access gap within the health facility electrification space. Sustainable Energy, on the sidelines of COP, actually launched a climate finance report, which outlines, the need in terms of the financing that's required. And this is not really a lot of money. It's only 5 billion USD. to be able to fully electrify all the 100,000 health facilities. And climate financing should ideally play a catalytic role, and especially in nascent markets, right? Health facility electrification, especially for public health facilities, is really a challenging space where you trying to create long-term energy as a service business models where you're utilizing private sector capital to be able to undertake the task. And climate financing sources should really be the ones that are providing the risk mitigation mechanisms that are required to be able to meet the objective. So looking at the need is very small, right? And mechanisms like GCF should be easily accessible, not as hard as they are right now. And they should be the mechanisms that should, support some of these market-led models that we're trying to deploy within the health facility electrification space.
Great. And Ibrahim, you had something to add to that as well?
Yes, Leland. We already think about seasonal changes when it comes to the diseases like malaria. You need to track the right amount of medications in stock and at the right times. So climate changes could alter a number of factors, such as the timing of the seasons, the amount of rainfall, and where the mosquito lives. If we see malaria moving into new regions or appearing at different times, we might see an uptake in anti-malarials being sold in different facilities that is different from what's expected. So it's crucial to be able to monitor this so we are not taken by surprise and allow malaria to spread. Yeah.
Yeah, great. Thank you. That's a really good concrete example of how it's having impact with individual health facilities. We have about 10 minutes left, and I want to be able to bring in some of the questions coming in from the audience. And for the audience, please do add any more in the chat. But a really, really crucial one we got. I would like to hear some suggestions on strategies for sustainability of the interventions, especially where support is provided to get access to power, solar, and internet. My experience has been once the support from the funding agency ends, the project collapses, beneficiaries fail to sustain the provided service and wait till there's another donor. Yes, we have all heard these stories, and it's something that we've been working very hard to design this program to avoid. So any panelists want to grab that one first?
I can take it from the aid side and then pass it to Joan on the implementation side. So this program was designed first and foremost to avoid the traditional grant making of a donor institution and then handing over the kit to a health facility to operate and maintain. As I said earlier, that is unfair for a donor community to be expecting healthcare workers to also be maintaining a PV, solar, and battery. They're not engineers, and they shouldn't be. They have a big enough job already. So we really are challenging both Apt Associates as the lead on this partnership and our partners to walk themselves back into this program. Look at operations and maintenance first, create the productive use of providing energy as a service, not installing and handing over the kit, but providing energy as a service. And what are the other productive uses that can help maintain the operations and maintenance and revenue that's needed for the operations and maintenance in order to still be providing the connectivity services to the health facility? And then Joan probably has something more specific on the implementation.
To add to that, thank you so much, Gina. You've probably said it all. But I just wanted to add another angle. While it is really easy to be able to deploy interventions for the private sector, so private health facilities, the narrative for public health facilities is a bit different. And to be able to design a scalable business model where a private sector partner can ideally put in skin in the game and invest in capital expenditure and capex and the entire cost of providing solar infrastructure. Remember, to be able to install solar, you need a very high upfront cost, we really do need other mechanisms to come on board. This would be risk mitigation mechanisms that can support, and the risk process. And we are currently working with different agencies to come up with, those mechanisms that can provide that first loss risk guarantee mechanism and also take away the payment risk that is associated with payments from government. Back to you, Leland.
Thank you so much. And Ibrahim, we'd love to also hear from you from sort of the, you guys are of course building a sustainable, business on top of all of this. So we'd love to also hear your perspective on the financial sustainability.
Yeah, thank you. So to speak on the sustainability of this, for measurements, what we did at the very initial stages, we sought a partnership with a banking institution, Amana Bank to be specific, where we signed an MOU with them. They are like a financier, and then we form partnerships with ADOS associations in these specific regions that we were targeting. So we have already signed about 4 partnerships right now and electrified and digitalized more than 80 facilities under this partnership. But as the HETA project is going to an end, we have already approached the other banking institutions because, this is a big project. One financial institution cannot sustain it. So we have already submitted a concept note with Maendeleo Bank. And we are on a discussion to submit another concept note with CRDB Bank. All we are thinking about is sustainability of this model, because we see how our clients are benefiting as we get feedback from them in daily basis. They like this model to be sustainable, and Measurements is taking that lead to make sure that we get there.
Just to add very quickly, Leland, the pilot is what is coming to an end, but we are happy to take the lessons from the pilot and scale them up. And I'm happy that Measurement is already looking for, other partners within the financial institutions that we can then design a scaled up intervention in conjunction with the other players.
Great. Thank you, Joanne. And we have about 3 minutes left. I would love to be able to close us out with any sort of final thoughts from you guys. Anything you have to say to sort of cap this off. Maybe starting with you, Ibrahim.
Thank you, Leland. When we think about electrification, it's important to think about the electricity, what electricity does for the community. In our case, it's not just about boosting business for adults with limited connectivity. It's about supporting first-line health facilities that serve the community. Now, with the HETA project, we have seen our network grow from 400 to 700 plus just in 4 months. Self-onboarded facilities have grown, meaning that more people are getting awareness about Measurement system from families and friends who are benefiting from the HETA project. We have signed 4 partnerships, as I've said earlier, with ADOS associations from different regions. And now both Maendeleo Bank and CRDB Bank are looking to partner with us because of the work we have already done with the Zola Electric company under the HETA project.
Thank you, Ibrahim. And Joanne, any closing thoughts?
Absolutely. It's always about, making sure that we are providing the last mile connectivity and electrification to health facilities, and really seeing that benefit translate to surrounding communities. I'm really excited about the opportunity to develop digital hubs and offer that training to a majority of rural youth who are really looking for opportunities to be able to plug in within the digital space. And HETA provides us that platform to be able to not only look at the health facility, but also look at, the gender and social inclusion and work with the youth in some of these communities. So I'm really happy about this potential partnership, with the partnership with Measurements, and potentially opening it up to seeing how we can be able to scale it with additional, companies who are within the space. And let's see what 2024 holds. Thank you so much.
Thank you, John. And then Gina, I think we can sneak you in under the wire.
Okay, I'll be quick. Yeah, I just want to say thank you to all the participants and panelists today, and thanks, Leland, for moderating. I would just bring it back to in March of this year, we inaugurated a few facilities in Sierra Leone, and one of the head doctors, when we switched the lights on, said, "Where there is light, there is life." And that has stuck with me since that day, because energy is really the foundation to all of this. Energy is the foundation for digital connection. It's the foundation for climate. It's for climate resiliency and emissions reduction, and also for wash services and other extended services that modern healthcare systems have, and that we should be all looking to provide for the dignity of healthcare, right? And so, but you can't do that without energy. It all goes back to reliable energy. And so, even with a digital health forum and initiative, it's really important to focus on the energy connection.
Thank you so much, Gina, Joanne, and Ibrahim, and thank you for all of our attendees for listening in. Thank you so much. I hope you all have a wonderful rest of GDHF. And if anybody is around in DC or in Rockville, please do look for me at the conference center. Thank you so much.